Choosing the right orthodontist to treat you or your child requires careful consideration. This video is made available to introduce you to our practice and what you, as a patient or as a parent, can expect during your visits here. Many people think orthodontists are only concerned with the aesthetics or cosmetics of making teeth and smiles look nice, when in fact, orthodontics is primarily undertaken to correct improperly fitting teeth, discrepancies of tooth and jaw size, skeletal imbalances, irregular facial bone formation, and problems of the jaw joint. Actually, orthodontic treatment is primarily designed to produce the healthiest environment possible for the teeth, jaws, facial bones, and muscles. Many of the previous conditions can result in a bad bite, known as malocclusion. Malocclusion can detract from your physical appearance and, more importantly, cause serious dental as well as general health problems. Let us look at how a bad bite can cause dental problems. Teeth are supposed to fit together like cogs in a gear. When they do not fit together properly, they place unnatural forces on each other during chewing, causing the supporting bone to recede, teeth to loosen, and gums to become irritated and inflamed, leading to tooth loss and gum disease. A poor bite can also cause problems with the TMJ or temporal mandibular joint, that joint where the lower jaw meets the skull. A poor bite often forces the jaw out of its natural position, straining the muscles and ligaments every time the mouth opens and closes. Problems in this area are characterized by headache, muscle tenderness, spasm, neck pain, and clicking or physical damage in the joint. Timely orthodontic treatment can intercept a bad bite, preventing future problems. Dr. Iacobelli and our doctors are orthodontic specialists who by law are dentists who must limit their practice to treating orthodontic problems. Because our doctors concentrate on this discipline, they are able to provide the most comprehensive and efficient orthodontic treatment. Having completed 2 to 3 years of graduate education beyond dental school, the orthodontist has acquired the special skills necessary for accurate diagnosis of complex orthodontic problems, clinical management of tooth movement, and the guidance of facial growth and development. The goal of our practice is to provide the highest quality orthodontic services through a team effort of doctors and support staff. Our highly trained clinicians carry out the doctor's prescribed treatment plan as effectively and comfortably as possible. Using the latest holistic techniques in treatment, we personalize our therapy to optimally suit each patient's individual growth status and/or needs. When you or your child have been referred for an evaluation, you will be scheduled for an initial exam. At this appointment, a general clinical exam will be performed to determine the overall nature and extent of the treatment required. You will have the opportunity to ask any pertinent questions at this visit. Diagnostic and treatment concepts will be illustrated using our computer interactive visual educational system. And at this time, we will provide you with a written treatment plan. The age at which orthodontic treatment is started is very critical. Starting too young, patients can remain in treatment 4 to 5 years or more, which leads to reduced enthusiasm, lack of cooperation, as well as needless expense. This extended treatment time also places greater costs and hardships on the parents who must accommodate these extra visits into their busy schedules. Conversely, if treatment is postponed beyond the original growth spurt, length of treatment time is unnecessarily extended and sometimes can be too late to correct certain problems. When treatment is holistically timed to coincide with the rapid growth spurt, the quicker and more long-lasting the final results. Treatment can be accomplished best when the child is growing rapidly during the early adolescent years. In addition, treatment becomes more efficient, ensuring better patient cooperation and ultimately a shorter and less costly treatment. If your child is not ready to begin treatment, he or she will be placed on our recall program. We carefully schedule future periodic exams at no charge to monitor your child's dental and facial bone development until the optimum time to begin treatment. When treatment is to begin, a records appointment will be scheduled. Digital 3D scans of the teeth are taken for study models. Our digital 3D scanners have eliminated the need for unpleasant old impressions. Facial and oral photographs and digital x-rays will be taken. All of our digital data is stored on our cloud-based system. This allows our doctors and staff to retrieve your information at any location or at any time, along with your clinical data and patient information to keep your course of treatment comprehensive and flowing most efficiently. The cephalometric X-ray is an important diagnostic record. It allows the comparisons of dental and bony structures to standard values. The panoramic X-ray is taken to show all of the teeth and surrounding bony structures, making the curved jaw appear flat on the X-ray film. TMJ X-rays may be required if there is a question about the integrity of either of the joints. Facial photographs are used to study the profile and facial contours and allow the doctor to make determinations about the soft tissue relationships to the teeth and smile. Next, a consultation appointment will be set up, at which time the patient's problems and treatment plan will be illustrated and discussed in detail. Patient educational counselors are a unique feature of our practice and carry much of the responsibility of our office educational program. The patient is made aware of the types of appliances that will be used during the various stages of treatment. Also, the importance of the patient's role as a cooperating partner in achieving satisfactory treatment results is discussed. The anticipated length of treatment, usual and customary fees, financial arrangements, payment plans, and the extent of insurance coverage will be discussed at this visit. At this time, we encourage any last-minute questions or discussion of treatment options. If early treatment is necessary for your child, it is important that you understand some of the key considerations. In the past, if crowding existed, the removal of teeth was a technique frequently used. However, recent research has shown that it is actually the jaw that is too small for the teeth in most of the cases. Recently, advances in orthodontic treatment provide techniques for enlarging the size of the jaw, correcting the source of this problem. We may therefore recommend the use of orthopedic forces to stimulate jaw growth, making room for the permanent teeth. The benefits of this approach are a broader smile and a well-balanced facial profile. Not extracting permanent teeth also prevents the collapse or sinking in of the facial bone structure, leading to a healthier environment for the jaw joint. This approach requires two phases of treatment. The first is the orthopedic phase, to stimulate the growth of the jaw with various appliances so as to accommodate all the incoming teeth. The second is the orthodontic phase, with full braces to precisely align the teeth and develop the correct bite. Although our office is committed to the non-extraction of permanent teeth, periodically there are a few cases which are so crowded they require removal of teeth. Adult treatment is usually undertaken for functional health improvement and not necessarily for cosmetic purposes. The following are some of the procedures you will experience as you undergo orthodontic care. The braces are applied by bonding the bracket directly to the tooth, and not by the old way of cementing a band around the tooth. Wires are changed approximately once every month into pre-angulated brackets. This eliminates most bending or tightening of wires. These pre-angulated brackets provide more gradual, precise movement, with our patients experiencing less discomfort. We rarely use external devices such as headgear. Our braces are small, easy to keep clean, and very aesthetic. Clear brackets have been perfected for those who desire a less conspicuous look. We rely heavily on the use of skeletal elastics to help direct the jaw growth during a child's optimal growing periods. If the teeth cannot be moved into proper position through corrective orthodontics, orthognathic or corrective jaw surgery may be required to align the jaw structures and teeth into their proper positions. The usual treatment time will range from approximately 18 to 24 months. Clear and visible retainers are worn after treatment to maintain proper tooth alignment. With our Invisalign program, a series of these aligners can also be used to complete all of your treatment. Our practice has been rated as a preferred provider status due to the high level and number of cases we provide through our Invisalign program. You will receive a patient's progress slip after each visit with areas of concern in red and next appointments at the bottom. Our open clinic policy allows parents to observe any phase of treatment. We believe that knowledgeable people make informed decisions and become our best patients and our best source of referrals. We hope you have enjoyed this preview of our office. Remember, we are here to provide the most comprehensive orthodontic service available. Hopefully, our expanded office hours will accommodate most schedules. We also utilize our voice-over IP phone system, text reminders, and email notifications for any and all of your visits to assist patients and parents with their hectic schedules. Once you are here in our office, our computer sign-in system keeps our clinical staff aware of your arrival and waiting time to keep your waits at each appointment to a minimum. Our convenient locations make us most accessible for patients in northern Oakland, Macomb, Genesee, and Lapeer counties. Our entire staff looks forward to providing you with not only the highest level of professional care, but we hope to make your orthodontic treatment as supportive and rewarding an experience as possible in improving your health and smile for a lifetime.